Good afternoon and welcome to our first virtual workshop for the Healthy Life Ministry of St. John's Congregational Church. My name is Minister Blanche Martin, and I am the chair for the Healthy Life Ministry. Today, we are going to present to you a workshop entitled COVID-19, Let's Stay Informed. The mission statement of the Healthy Life Ministry is, the Healthy Life Ministry works to better the congregation and the community, and to build the body of Christ through its spiritual commitment to God for our spiritual growth and health in all areas of life. Our purpose and ministry is to strive to make the congregation, the church, and the community aware of a healthy way of living by distributing information, conducting workshops, and advocating for people to be a healthier in all areas of their lives. Today, our moderator will be Mrs. Stell Early. Ms. Early is a registered nurse who retired from Bay State Health System. She has over 40 years of experience in working in the healthcare field in a variety of nursing settings. Estelle is still advocating for healthcare issues and is an active member of the Western Mass Black Nurses Association and the National Black Nurses Association. She is a woman of strong faith and gives all praises to God. As a faithful member of St. John's Congregational Church, she is a member of the Healthy Life Ministry team and also serves as a tutor for the church's Action-Centered Tutoring Service, also known as ACTS, which is a faith-based after-school program. And now, without further ado, Mrs. Stell Early, our moderator for today.
Thank you, Nisi, and hello and welcome to the Healthy Life Ministry of St. John's Congregational Church as we present our first webinar on COVID-19, Let's Stay Informed. Our ministry felt that during this pandemic, where for months we have all been mostly at home, quarantined, our churches and many businesses have been closed, we felt this was a way of connecting with you, our viewing audience, and to assist you with the latest information surrounding COVID-19. We have invited two panelists who will be informing us from their perspective what you may want to know or need to know going forward in this environment. Our first panelist is Dr. Johnny Wright. Dr. Wright is currently the Regional Medical Director for the Connecticut Department of Corrections. He received his medical degree from Ross University Medical School. He holds a BS in biology from Tougaloo College in Mississippi. He also holds a podiatry degree from Ohio College of Podiatric Medicine. In addition to his full-time position with the state, Dr. Wright also owns and operates his own private medical practice in the evenings and on weekends in Windsor, Connecticut. Dr. Wright has volunteered with Safe Deposit Box, Inc., an organization dedicated to impacting the lives of young men in the greater Hartford area. He's also a member of our St. John's Congregational Church, currently resides in Agawam with his wife, Clarissa Wright. Thank you, Dr. Wright, for agreeing to participate in this webinar today. Our second panelist is someone I personally know. She is Ann Mistovar. Ann has over 25 years of professional nursing experience. She is a public health nurse and a nurse educator. She earned her Master's of Science in Nursing from the University of Phoenix, her BSN from Northeastern University. Ann is actively involved in community health initiatives and serves as president of the Western Mass Black Nurses Association, where I too am a member. And she also serves as a board member of the National Black Nurses Association. As a public health nurse during the COVID-19 pandemic, Anne has been on the front line implementing guidelines for the state of Massachusetts. She is also pursuing her doctorate in nursing. So congratulations and best wishes, Anne. And we thank you for agreeing to share your expertise at this webinar today. Our panelists will first share with our audience, who consist of members of our church family and members of the community, their individual backgrounds and information surrounding COVID-19 from their perspectives. Following the presentation of both panelists, the members of the Healthy Life Ministry will ask each of them a variety of questions that were developed during our planning session. So with no further ado, we will begin with Dr. Wright. Thank you, Dr. Wright.
Thank you. Thank you for inviting me to this forum. It's a pleasure. Let's get started. The first reported U.S. case of coronavirus, known as COVID-19, was detected in January 2020. As of this date, approximately 7 million cases and over 200,000 COVID-19 related deaths have been reported in the United States. In just the last 7 days, there have been over 300,000 new cases. A high proportion of these cases have underlying conditions such as diabetes, hypertension, obesity, cardiovascular disease, and chronic respiratory diseases. Infection with COVID-19 can have multiple symptoms. The most common are fever, cough, and shortness of breath. And most recently added is loss of taste or smell. Symptoms that are less often discussed include gastrointestinal symptoms, symptoms such as loss of appetite, nausea, vomiting, and diarrhea. We've also seen other cases that involve skin changes, confusion, and eye problems. There are currently 6 known strains of the virus. It turns out that unlike the measles, mumps, or chickenpox, the coronavirus does not remain dormant in the body and is not reactivated later. So what should you know about COVID-19? How do you protect yourself and others? COVID-19 is a new coronavirus that has been spread throughout the world and can range from no symptoms to severe illnesses. Know how it is spread. You can become infected by coming into contact, close contact that is, usually within 6 feet of a person who has COVID-19. It is spread primarily from person to person. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. You may also be able to get it by touching the surface or an object that the virus is on, and then touching your mouth, nose, or eyes. Protect yourself and others from COVID-19. There is currently no vaccine to protect you against this virus. The best way to protect yourself is to avoid being exposed. So how do we do that? Stay home as much as possible and avoid close contact with others outside of your immediate surroundings. When in a public setting, wear a mask that covers your nose and your mouth. You should also make sure you're not allergic to the material, make sure the mask fits properly, and that it's kept clean and changed regularly. There is no evidence that face shields that are open by design prevent the inhalation or exhalation of viruses. For the average member of the public who is not exposed to splash or splatter events in the face, a shield is unhelpful. A face mask covering instead, that's the best option for protection. Remember to clean and disinfect frequently touched surfaces. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer, one that contains at least 60% alcohol. You want to practice social distancing. Buy groceries and medicines online. See your doctor online when possible. Complete banking activities online when possible. We want to prevent the spread of COVID-19. So if you feel sick, you should stay home, self-quarantine for at least 14 days. If your symptoms worsen, you should then seek medical care, especially if there are other underlying medical conditions. You want to avoid public transportation, ride sharing, and other taxi services. Separate yourself from other people and pets in your home should you become infected. There is no specific treatment for COVID 19. Everybody is at risk. Older adults and people of any age who have serious underlying medical conditions can be at a higher risk for more severe illnesses. This virus is constantly evolving, it's constantly changing. We're still learning daily more and more about how it affects our health. It has impacted the Black and the Brown community in a disproportionate rate. We see this in people from specific racial and ethnic minority groups. Our communities are more likely to be uninsured. We're more likely to have problems with transportation, problems with taking time off from work, and problems with daycare. People from our community tend to work in jobs considered essential, such as factory, grocery stores, and healthcare facilities. This, in and of itself, creates more chances for exposure to this virus. Now, as our schools begin to reopen, educators and parents should continue to remind their students and children to wash and sanitize their hands often. They should be reminded to keep physical distance from other students. Most importantly, wear their mask. Avoid sharing objects such as pens, pencils, or the other personal devices. Before leaving school, students should again be reminded, wash your hands, use hand sanitizers, refrain from touching doors and other surfaces directly as they exit and enter. This can be achieved by using held hand cloths or paper towels. Remember, clean, clean, clean. Now, another flu season is right around the corner, and this year we are experiencing it in the midst of this global pandemic. Both COVID 19 and the flu can have varying degrees of signs and symptoms, such as cough, fever, shortness of breath. Now, with COVID, we see changes in or loss of taste or smell. With COVID, we may be contagious for a longer period of time. When compared with the flu, there is typically no reported loss of taste or smell, and the period of contagiousness is shorter. Since these two mimic each other, testing may be necessary to confirm diagnosis. Therefore, I would encourage everyone to get the flu vaccine. It will neither prevent you from getting it or make you more susceptible to it. It will decrease your chances of exposure due to the need for outside clinic visits or hospital admissions. And this will assist our healthcare workers in continuing to focus their efforts on treating people with COVID 19. Thank you for this opportunity.
Thank you, Dr. Wright, for that most informative presentation. And I know we can all take heed to just some of the information that you shared. We will now have Ms. Ann, our nurse Ann, give you an update in the world of COVID-19 from her perspective, and perhaps share with all of us how we can continue to survive life in this pandemic setting. Ms. Ann, thank you.
Thank you, Estelle. Thank you for your kind introduction. It is a pleasure to be here today and share this information with the community. I am here to talk about what has been on everyone's minds this past 6 months, the COVID-19 pandemic. COVID-19 pandemic has made us pay attention and realize what is important: family, individual health, not necessarily in that order. Our lives have been going at a fast pace, fast food, fast internet, fast cars. We've had no time for each other. And the next thing we know, we are being told to quarantine, to stay at home. As a result of this shutdown, people lost their jobs, people lost their homes, people lost their lives. We were forced to spend time with each other. We were forced to spend time with ourselves, our own thoughts, things that we took for granted. But three things remained constant: our family, individuals, and health. Now more than ever, we have come to realize how crucial wellness and health promotion are. We must keep up to date with yearly physical exams and immunization as appropriate. Stay in touch with our healthcare providers and practice self-care. All those things we took for granted. We now know, like Dr. Wright mentioned, that everyone is at risk for COVID-19 and that your state of health plays a role in how your body responds to COVID-19 infection. We are forced to face this unknown. Now, when we get up in the morning, we must take a minute and thank God for being alive. We must take a minute to check with ourselves. We must check with our bodies, check our minds. This is the new normal, like it or not. Do I have a fever, cough, shortness of breath? The list goes on. And we cannot go anywhere without checking with our health. As a nurse working in the front line, I have seen how important staying healthy is, how important health promotion, exercise, healthy eating, and having a support system. We now know more about COVID-19. We know that some people, especially the older adults and people with underlying health issues, are more at risk for the virus. We need to stay up to date on the latest guidelines from CDC and the Massachusetts Department of Public Health. The CDC and the Massachusetts Department of Public Health websites are your best source of information. The guidelines are updated continuously because researchers are discovering new information on the virus. If the unthinkable should happen and you have COVID-19, please answer the phone when the health department calls you. If someone from the health department calls you, answer the call to help slow the spread of COVID-19 in the community. Discussion with health department are confidential. This means that your personal and medical information will be kept confidential and private. Information will only be shared to your healthcare provider. Your name will not be shared with those you came in contact with. The health department will only notify people you were in close contact with, within 6 feet for more than 15 minutes, that they might have been exposed to COVID-19. Tell the health department staff if you develop symptoms of COVID-19. If your symptoms worsens or you become severe, you should seek emergency medical care. Your local Board of Health is a great source of support. They can answer questions that you may have and put you in touch with resources in the community, and reach out, and more importantly, reach out to your healthcare provider as well to help you monitor your health. Everyone should have an emergency preparedness list in case they have to isolate or quarantine. Things such as water, food, medicine for 30 days, emergency contact information, your doctors, dental, close family members who can drop off foods and medications for you in general to check on you. And like Dr. Wright said, remember to always wear your mask, watch your distance, wash your hands. According to the CDC, masks are recommended as a barrier to help prevent respiratory droplets from traveling into the air and onto other people when the person wearing the mask coughs, sneezes, talks, or raises their voice. This is called source control. Wash your hands before you put on your mask, and wash your hands or use hand sanitizer before you remove your mask. Try not to touch your face while you're wearing your mask, and wash immediately after removing the mask, and wash your hands when you get home. Social distancing can be a challenge. You may start talking from 6 feet distancing and find yourself moving because you can't hear the other person. So let's continue this conversation and find out more and be mindful about our distancing. So let's continue this conversation and find out more information. Let's stay informed. Thank you.
Thank you, Anne, for that. From your perspective, that information we all can use, even though we may have heard it over and over again, we still need to hear it and follow those suggestions. And now, since we will now entertain questions from our members of the Healthy Life Ministry that we prepared during our planning session. So we will begin with the questions as noted. I do believe Clarissa Wright has a question for both Dr. Wright or Ann.
So, Dr. Wright, I wanted to ask, how important is it to wear a mask?
Wearing a mask, again, is the first line of protection. It is so important. It's going to prevent greater than 90 to 95% exposure when it comes to this virus.
Ms. Mistovar, what are the best types of masks to wear?
Face coverings are what the CDC and DPH are recommending. They are not specifying a particular type of mask for the general public. It is also important to wear a face covering properly, like Dr. Wright had mentioned earlier, by covering your nose and your mouth. Do not use a mask meant for a healthcare worker. Currently, surgical masks and N95 respirators are at critical supplies that should be reserved for healthcare workers and first responders. Thank you.
And so, Dr. Wright, I have another question for you. How important is overall hygiene when we're dealing with COVID-19?
As I mentioned in my introduction, the importance of washing your hands, and not just washing your hands for 5 or 10 seconds, but washing your hands for up to 20 seconds. I know that can be difficult at times, especially with our busy schedule, but that is the most important means by which we can prevent the spread of this virus. And in case there's no available place like for water and soap, the next best thing would be a sanitizer that is alcohol based.
Thank you.
Ms. Mistovar, wearing a mask often irritates the skin on our face. What can we do to prevent facial outbreaks and irritation and to treat our skin?
First, avoid touching your face. Also, try different types of masks to see which ones irritates less. Good skin care. And if that does not work, see your doctor or a dermatologist to help. It may be that there's another underlying conditions that must be addressed.
Thank you.
The question that I have, first I'm going to ask Dr. Wright, and then I will follow up to see if Ms. Mistovar has any follow-up. That question is, do the experts recommend that people wear masks in their homes when there are multi-generational high-risk family members living with them? So that's first for you, Dr. Wright.
So any person of any age living in a family household where there is underlying illnesses, those individuals should carry on as if they themselves are, that they themselves might be just as exposed or just vulnerable to COVID. That way, you prevent bringing that back to the family members that have these underlying conditions. So they should treat themselves as though they have the underlying conditions too.
And Ms. Tavar, do you have any follow-up with that?
I would say if you are diagnosed with COVID and you live with a multi-generational family, it is important to wear a mask. As much as possible, stay in a specific room away from other people. So the mask will prevent the person who is sick from spreading the virus to others.
Thank you.
So, Anne, as a public health nurse working in the community, how important is contact tracing, and what is contact tracing, and how does it prevent the spread of COVID-19?
Contact tracing is key to slowing the spread of COVID-19, and it helps to protect the individual, their family, and the community. So letting people know that they may have been exposed to COVID-19 and should monitor their health for signs and symptoms. So the local Board of Health may provide contact tracings. The state also provide contact tracings, and contact tracings help people who may have been exposed to COVID to go get tested, asking people to self-isolate if they have COVID-19 or self-quarantine if they are a close contact. And during contact tracing, the health department staff will not ask the individual about money, social security number, your bank account, your salary, or any of that information. So if someone calls you and say they are doing contact tracings and they're asking personal information regarding your money, your social security number, you should hang up and call to report them. But contact tracing is very important. It helps people to be isolated, people that are positive with COVID-19 to stay away and isolate from others that could be that could transmit the disease to other people. And it also identify contacts of the individual that is confirmed. We call people that are COVID positive a confirmed case because it is lab confirmed. Sometimes people could be considered symptomatic and not have had lab. If the doctor may say you have symptoms of COVID-19, then you should stay at home, you should isolate. They should follow the doctor's guideline and isolate and remove themselves from their family, stay in a separate room if they can. And I do understand not everybody has the luxury of having a private bathroom, but staying away from other family members as possible, not going in the community is important.
Thank you, Anne. We have another question from one of our other members, Charlene.
Dr. Wright, how important is it to see a doctor if you have any symptoms?
So I believe the question was, how important is it to see a doctor if you have symptoms? Well, in the very beginning, one thing that we didn't want was a person with symptoms coming into our office. That would just jeopardize the office personnel and any other patients that were there presently with no symptoms of COVID. So the first thing, and should continue to be the first thing that one does when they feel this way, is to first call the clinic or call the primary care physician and explain the symptoms. The three standard ones: fever, cough, shortness of breath. The shortness of breath is usually mild. We're not talking shortness of breath that an individual seems distressed, is saying, I can't breathe, or I'm having problems breathing. So then after consulting with the doctor over the phone, he can make recommendations whether or not you are good to maybe quarantine for the 14 days or suggest further testing since you have the symptoms. In the beginning, that was a problem because of the scarcity of the tests to be performed. But now, if you have these symptoms and the likelihood that sometimes individuals with no symptoms are still spreading the virus, the thing now is to go ahead and get tested. If anything else is going on that is worse or more concerning, I'm sure the the physician would recommend further follow up in an emergency department.
Thank you. Ms. Savar, if you're someone who has symptoms but you don't have a primary care physician, what should you do?
At this time, and this may change, the state is providing free testing. Finding where free testing are available is important. And also, if that fails, urgent care centers or places where ideal for individuals to go and be tested. The urgent care centers also have doctors and nurse practitioners that could also not only do a test, but they could also perform a quick physical and identify any other symptoms and underlying conditions that the individual may be experiencing.
Well, next, my question is for Dr. Wright. Dr. Wright, is it safe to go to the dentist?
I'm going to say yes, simply because a couple of months ago I did go to the dentist. And when I went inside there, even before I went through the door, there were questions of where I'd been, my symptoms. That was before I even got into the door. These were questions while at home, and then another phone call once in the parking lot. And then once I cleared their checklist, I was then allowed in. Once I was in, the personnel had the plastic shield. The hygienist and the doctor were both covered with a closed face mask, shield, gloves, the whole works. So I felt very safe, very comfortable, and I'm sure they did too. And so I would say yes, if everybody is following those rules.
I would add to this that I also went to the dentist recently, and it is important to maintain good hygiene, and going to the dentist and taking care of your oral health is important so to remain healthy.
Dr. Wright, why does COVID attack obese people? Is it because of the underlying conditions that accompany obesity, or is it the obesity itself? Thank you.
The question is, how does obesity affect the worsening or even the getting COVID? So obesity in the COVID state, well, let's say not even in the COVID state, decreases the ability of one to breathe. Okay. And if you have a decreased ability in breathing, you're going to have a decreased ability in removing mucus from your lungs. Obesity, fat, whatever you want to call it, is biologically active, okay? And it causes a lot of other metabolic conditions. Those metabolic conditions can vary from hypertension, diabetes, all the way to high cholesterol. So having an added factor of having a BMI that's greater than 30 does increase your chances of not having a good outcome if you contract this virus.
Miss Devar, I want to know, this is a two-part question. First part is, what role does age have in getting COVID-19? And the second part is, are people over 65 more likely to get this virus?
So as you get older, your risk for severe illness from COVID-19 increases. So for example, people in their 50s are at higher risk for severe illness than people in their 40s. Similarly, people in their 60s or 70s, or in general, are at higher risk for severe illness than people in their 50s. So you can see where I'm going with this. So the older the individual, the more likely, the greater the risk for severe illnesses from COVID-19. And the individual that are age 85 and older are at a greater risk for severe illnesses.
Dr. Wright, since COVID attacks the lungs, will deep breathing exercises help to improve our immune systems, and why? Thank you.
So, deep breathing exercises. You said, will it increase or help the immune system against COVID? I'm going to think probably not. In the sense that if I go around taking real deep breaths and doing special breathing exercise, that I won't get it. Okay, I'm not going to get it because I am taking precautions with the mask and with the surfaces and the distances that I'm exercising. So now, if I happen to contract COVID-19 and I'm having problems with moving air, some techniques are known to be beneficial. And one of those techniques is called proning. And proning is just basically lying on your stomach. It does have a way of opening the lungs and enabling the patient to move more air and to remove more mucus. But typically, a good deep cough is important to remove deep-seated mucus, which can prevent any accumulation of mucus, which could lead to pneumonia, et cetera, et cetera.
But Ms. Savar, Dr. Wright just talked about deep breathing, but we have another question about breathing exercises. What breathing exercise, if any, should we be doing to help prevent coronavirus from attacking our lungs, and how often should we do them? Should the breathing exercises be done first thing in the morning, when we wake up, in the afternoon, or at bedtime?
Well, I'd like to think that we are doing deep breathing all the time. Deep breathing helps to move secretions out of the lungs. Early in the morning, sometimes some people may have a little bit of secretions in the lungs. So doing deep breathing, cough, and deep breathing helps to move the secretions out of the lungs. And before you go to bed, also doing some deep breathing exercise, coughing to move secretions out of the lungs. General exercise, also deep breathing to help relaxation is also very helpful. In this day of COVID-19 where we are all anxious, we are afraid, sometimes it's important to take deep breaths. We may not be aware that we are holding our breaths because we are afraid or we are anxious. So it's important when we think about it, take some deep breaths, take a few minutes, relax, take some deep breaths, and try to move the air in and out of your lungs to keep your lungs open and breathing properly.
Evangelist Clarissa, did you have a question for Dr. Wright regarding diet and exercise?
Yes. Dr. Wright, what role does diet and exercise have in helping to prevent COVID? Why is it important for us to keep moving and to keep a routine during this pandemic?
Okay, everyone knows that a good diet and, of course, exercising helps a lot of things. Vegetables, fruits, helps build the immune system, helps with preventing obesity. A routine can also prevent us becoming fatigued and deconditioned. Um, so those are some of the important factors of maintaining a good diet and a routine. Um, uh, your state of health, mental health, getting out, seeing people in a safe fashion, doing what we're doing now, maybe more Zooning to bring us close and to keep us safe at the same time. So it's very important, diet and exercise to increase and maintain our state of our immune state.
Ms. Mistovar, how important is it to consume a diet high in antioxidants to help prevent the coronavirus from attacking our system?
It is important to maintain a healthy diet. Your doctor, based on your history, can recommend the best supplement for you. It is not recommended to start an experiment with new diets before consulting your physician, especially in the state of COVID-19 where we really don't have all the information and we don't know what the interaction and the outcome of adding extra or high antioxidants in our diet. So the important thing is to keep in touch with your primary doctor and have a conversation about whether or not having an antioxidant, adding a high antioxidants in your diet is would be beneficial.
Dr. Wright, is it important to take vitamin D to help prevent COVID-19, especially for people with compromised immune systems? Thank you.
Thank you. There is some evidence to suggest that vitamin D might help protect against becoming infected with developing serious symptoms of COVID-19. We know, for example, that people with low vitamin D levels may be more susceptible to upper respiratory tract infections. A number of studies have found that people who took vitamin D supplements, particularly those who had low vitamin D levels, were less likely to develop acute respiratory tract infection than those that didn't.
Ms. Mistovar, are there any safe natural supplements that anyone can take to help prevent COVID-19 and to strengthen their immune system?
Because of COVID-19 affect individuals that are high risk, it's important to have a health maintenance regime. Your healthcare provider can work with you to help you identify nutritional supplement. Again, people that are at risk already have other health issues. Therefore, adding supplements without consulting with your physician at this time is not recommended.
These next questions I'm going to direct to Ann and Dr. Wright. We often hear that people are suffering from depression and other mental health challenges, especially being cooped up during this pandemic. Because of the lack of sunlight and seasonal depression is also a concern during the fall and winter. What can we do to help ourselves be more motivated and to help combat depression? Dr. Wright, I'm going to direct that question to you first. And Ms. Ann, if you could follow up.
Okay, so basically, as I said before, you need to maintain a routine. Um, you need to try to keep in touch with people um, that you love and that you care about. Um, Aside from making for sure that you are physically fit medically and that you have been evaluated by a licensed physician, it's very important to keep that up to date because there are some metabolic systems that can cause and can exacerbate depression in any state. So being up to date staying in touch and in touch with friends and family, the safe way, I think, is what I would recommend.
And I would add to that, your church is a good resource. So stay in communication with your ministry.
Thank you. Those are both perfect answers. Now, Anne, since we're spending a lot of time indoors and without mentioning any particular brand names, what tips can you give us about keeping our home sanitized? What types of cleansers and disinfectants are good to use?
Excuse me, CDC recommends EPA. However, most people are not familiar with how to recognize if a product has the EPA numbers. The CDC website have great resources to identify which products to use. However, good old soap and water, washing surfaces with soap and water is really good. um, Bleach, 1 cup to 10 cups water, but you have to make sure you're not allergic to bleach, that you don't use it on surfaces that, your pet or anybody's going to come in contact with. But just good soap, water, um, hand sanitizer, washing your hands, very important. Staying, not touching your face. Keep surfaces dry, not wet. Cleaning the door handles of the houses, the bathrooms, and really try to maintain and keep having a cleaning habit where, don't leave dishes in the sink, and try not to use others' dishes and utensils. So these are things to help us practice infection control.
Dr. Wright, will operating a dehumidifier or humidifier in our homes help to prevent the spread of the COVID virus?
Will it help prevent the spread of the COVID virus? I'm going to say yes. And just like, um, as you recall, when different people, different families, with new babies, um, they typically would have a humidifier or dehumidifier, depending on where it's at and how much better that helped breathing. We typically like to have a relative humidity at 40 to 60%. It just makes breathing a lot better. So I'm going to say yes on having the dehumidifier or humidifier in the home, promoting and helping to prevent COVID.
Thank you.
There's a few more questions that I'm going to start with Dr. Wright. And this one is, what recommendations, which I believe you may have covered in your discussion, do you have for people who work with children and are caring for an elderly high risk or an elderly high risk individual in their home?
Okay, so as I said before, and anyone of any age can become infected with COVID-19. We know children, we know where they like to stick their finger. We know how often they are putting their hands places where they shouldn't be. So again, we should try to make sure that um, if they're not doing it, that they're reminded to wash their hands, to keep an eye on them, and to make sure that they're using some type of hand sanitizers. We should treat those children as though they are at risk due to underlying condition, because that in turn keeps the person that has the underlying condition safe. It's just precautions. The more, the better.
Anne, did you want to chime in on anything?
To add to this, I would just say, just to support what Dr. Wright said, good hand hygiene, infection control, teach the children how to wash their hands, teach them to cough in their sleeves, and if anyone is sick in the house, to isolate and maintain social distancing.
Can I just stick in right quick and ask a quick question of either of you? And I will ask you, Miss Devar, when it comes, we talked about our children. What about shoes and things like that? Do they need to leave their shoes out before they walk in the house? What are your thoughts about that? Or in terms of clothing, removing their clothing when they come home from being outside? Do you have any thoughts on that?
Well, it depends on the family dynamic. If you have individuals in the house that are high risk and the children go into daycare and coming back into the house, it is recommended to remove your shoes and even to try and change clothes before you go hug your grandparents or to be in the environment of your grandparents. It is also recommended for people who work, essential workers, before they go inside their homes, to wash their hands and remove the clothing that they worked with before they go close to people that have underlying conditions.
And I would concur with everything that she said. That's dead on.
Okay, and for Anne, or actually for both of you, the hot topic is the flu vaccine, the vaccine that's being developed. From your perspective and based on the latest information, what is the earliest you feel that an effective vaccine would be available to combat COVID-19?
Realistically, we're looking at the end of the year, but should I say ideally, the end of the year, 2020, but realistically, one will not be available until maybe midsummer. And the individuals that would be first in line to get those would be our first line workers, our healthcare workers, and next would probably be, and Nurse Ms. Starver, you can chime in, may be our patients that have really severe underlying conditions. But first line workers and healthcare.
I concur with Dr. Wright. Vaccines have to go through different phases during their development. Although some of the phases have been curtailed or to make production more rapidly, but I'm hoping that they will still follow the FDA guidelines when producing vaccines. So we are looking, although like Dr. Wright mentioned, that they will talk about having something by the end of the year, but realistically, maybe next year.
Okay.
Thank you. Now, you just answered the next question, which is what it is the first group of people to receive the vaccine. So I like to expand on that question and find out, how are they testing the vaccine? Do you know that? And I'll ask Dr. Wright to answer that, and then Ms. Devar.
So basically, they're testing the vaccine on a select group of volunteers, and they're looking for an antibody response. Okay, most vaccines, that's where the protection comes. You inoculate with a deadened or weakened strand of the virus, and you hope that the body builds immunity against that particular strand of virus, so that once that individual comes into contact with that virus again, or comes in contact with that virus again, that the body has already mounted an immune response, and typically you see no illness or a very short illness course. So I hope that's what you were asking.
Yes, thank you. And Miss Ann, do you have anything to add to that?
I concur with Dr. Wright, and what he mentioned, it's called, clinical phases of vaccines.
Okay. What state websites or national websites can you recommend for us to get more information, Ms. Mistavar?
The CDC, the Massachusetts Department of Public Health are your best source of information. Your local Board of Health, your best source of information. And your healthcare provider.
And Dr. Wright, do you have any other websites that we can go to for information?
I don't believe I heard the FDA. So the FDA, CDC, the Connecticut Department of Public Health. I think that's about it.
Thank you.
Those are most of the questions that we developed, unless anyone has anything else that they would like to share before we wrap up our first webinar session.
I did just want to ask Dr. Wright one question. When
Certainly.
you did the presentation, you talked about animals, our pets, that we need to stay away from our pets. Why? If we have COVID-19?
Well, there has been some data that suggests that animals can actually get the virus. As a matter of fact, there's documented evidence of cats, dogs. There was one tiger in some zoo in New York, and there was a video online that went pretty viral back in the beginning of a dog with COVID. So it is possible.
And I have another question just to piggyback on that. Something just popped into my mind. Since this is a virus that can be given to animals and animals can give it to humans, what is the commonality? What makes it a disease that crosses both animals and humans? Is that something that you can answer?
Well, that's a pretty complex question. Okay. It comes about with contact. And when contact occurs between animals and people, especially animals that are being slaughtered for the market, these animals have certain viruses that would not normally live in human beings. But there may be a secondary vector, like say you have a pig, or you have a bat, that some kind of way those two viruses mutate in a fashion in which now it can be sustained in a human in a human's body, and then that way it makes that crossover, and then it's on its way.
Okay, thank you. And Mr. Var, do you have anything to add to that?
No, I believe Dr. Wright covered it nicely.
Thank you.
Well, we want to thank both of our panelists for agreeing to share their expertise on this important topic, because we know there are so many misconceptions surrounding this COVID-19, and I trust that our viewing audience has gained a better insight into the importance of following the guidelines of the CDC to remain safe, and also steps that each of us can take to make our lives as normal and healthy as possible in this new normal society going forward. So remember, wash your hands, wear your mask, and social distance when necessary. And again, thank you both, Dr. Wright and Ann, for your timely presentations. We know there's much more to this to uncover, but it's a beginning. And so we pray that our audience will receive this information. And now I will turn it over to our illustrious ministry leader, Blanche. Thank you so much, and God bless you both.
Thank you.
I'd like to thank everyone for being here today. For Mrs. Stella, our moderator, I thank you so much. For Dr. Wright and Ms. Mistovar, thank you for your insight. And for the Healthy Life team members who participated today, Stacy Pringle, Michelle Pringle, Estelle Early, Charlene McCoy, and for those who were not able to join us, Anthony Porter and Emily Harrison, I really thank you all. And for our special guest, Carissa Wright, thank you for participating. And this is just the first of hopefully many seminars that we will do via the virtual webinar method. So hopefully you will join us again. If you have any questions that we can answer regarding COVID-19, let's stay informed. You can email us at healthylifeministry84@gmail.com. Again, healthylifeministry84@gmail.com. And I'd just like to thank everybody who tuned in and watched this video, and I hope it was very informational for you. God bless you all.